One of the most common reasons candidates fail CASC is losing control of a talkative patient. You start well, but then time runs out. Let me show you how exactly to manage this situation professionally and still score marks. In CASC, you are not judged on how long you listen. You are judged on how effectively you gather information and structure the consultation. So, if a patient is very talkative, you must redirect, but do it politely. So, I'm now going to give you a course structure which will help you to manage a talkative patient in a structured and polite way. So the step 1 is to acknowledge. Remember, don't interrupt abruptly. First, always acknowledge what they have said. For example, say something like, "That sounds really difficult. I can see this has been affecting you a lot." So why are you going to do this sort of an acknowledgement? If you tend to interrupt the patient without empathy, you are going to lose marks. So the second step is to take control, but politely. Use phrases like, "If it's okay, I would like to ask a few specific questions to understand better." Or, "I just want to make sure I cover everything important, so I may guide the conversation a bit." So the key point here is you are asking their permission and not dominating the conversation. The third step is to redirect the task. Now, bring the conversation back to your clinical goal. For example, you can redirect by saying things like, "Can I ask specifically about your sleep?" Or, "I would like to understand your mood over the past few weeks." Or, "Let's focus on what has been happening recently." So this is where you are going to score marks for structure. The step 4 is to use time signposting, which can be of very high value. If the patient keeps talking, then you are going to use time-based signposting. For example, saying something like, "We have a few minutes left, so I would like to focus on," just to make sure we cover everything important. When you do this sort of a time-based signposting, the examiners really love this sort of an interview style. Step 5 is to be followed if the patient goes off topic again. Then you are going to summarize and redirect. For example, "So from what you have told me, things have been stressful at work. I would like to now ask about your sleep and appetite." What are the common mistakes? The common mistakes which candidates do and lose marks are they let the patient talk endlessly, or they interrupt rudely, they lose structure, and they don't cover the key areas. Remember, when you express empathy and when you keep your conversation structured, the outcome is a pass in the station. Let me show you a quick example. Imagine if the patient says, "And then my neighbor said something and I felt really upset." So for a conversation like this, where the patient is too talkative and taking you to random directions, now you need to reset and redirect. So what you can say, acknowledge, that sounds really upsetting, and then gently interrupt and redirect. If it's okay, I would like to ask a few specific questions so I can understand better. Could you tell me how your sleep has been recently? Now you have managed to redirect a talkative patient back to the task. If you can acknowledge, interrupt politely, and redirect with structure, you will stay in control of the station and score marks. Let me know in the comments, do you struggle more with talkative patients or angry relatives? See you in the next video.